We need to move faster. That is the urgent message today from Governor Beshear on the vaccine rollout in Kentucky. This afternoon, the governor updated the state's 4 phases of distribution. Phase 1A is already underway. That includes healthcare personnel and patients and staff at long-term care facilities. Phase 1B will include people over 70, first responders, and school personnel. Some local health departments have already started vaccinating first responders. The governor hopes all of 1B will begin by the end of January. Phase 1C will be anyone over 60, anyone over 16 with high risks, and all other essential workers. Phase 2 is anyone over the age of 40. Phase 3 is anyone over the age of 16. Phase 4 will be children under the age of 16 if the vaccine is approved for this age group. The governor says everyone should have access to the vaccine by June. But as Shelby Smithson explains, right now the state is focusing on stepping up the pace. That story first on Fox.
Let me be clear. I am not satisfied by the pace of vaccination here in Kentucky.
A slow start to vaccine distribution has Governor Andy Beshear reevaluating the rollout. Out of more than 120,000 doses that have been delivered across the Commonwealth, only about 60,000 have actually been administered to Kentuckians.
The goal is to not have vaccine sitting in a freezer. The goal is to have vaccine administered to willing recipients who want to have the vaccine.
It's not only the pace of vaccinating people that health leaders want to speed up, it's also how quickly those shots are being reported to the state.
Now, groups that are vaccinating are supposed to report within 24 hours every vaccination. That target is not being hit. And so we're going to be communicating to each and every one of those providers that that is a must and that is a requirement to get additional doses of vaccine.
And another requirement providers will be pushed to follow the state's new goal of administering 90% of all doses within 7 days of arrival. While the state will be following its phased distribution process to an extent, their focus now is on the pace.
The goal now is to give it quickly and to focus a little bit less on who is getting it and prioritize getting it out as fast as possible to as many people willing to have it.
At the state capitol, Shelby Smithson for the Fox 56 10 o'clock news.
To help speed up the separate program responsible for vaccinating long-term care facilities, the state has also offered support from the Kentucky National Guard.